Welcome back. Here with us on Bazaar Morning Call. The first company on our radar this morning is MedPlus Health Services. The growth was a little muted, but margins have improved in the fourth quarter. Profit has been aided by operational improvement as well as higher other income. So that's the Q4 picture that's flashing in front of you. Let's discuss the prospects for FY25. We have Mr. Gangadi Madhukar Reddy, MD and CEO at the company, joining in. Mr. Reddy, thank you very much for joining in. Good to have you on. So I just read out the fourth quarter performance where margins have improved, profits are looking good. For the year as a whole, FY25, your revenue is up 9%, but the margin has come down from 6.3 to about 4.5%, thereabouts. So let's just talk about, the strategy from here on. You've had a very aggressive store rollout, plan as well. You rolled out, I think, 305 stores last year. This year, you plan to roll out 600 stores. So just walk us through the top line growth, how the old stores are doing, the same store sales growth, and how the new stores are faring for you.
So the new stores are on track. Typically, we expect them to break even within 3 months, at least 50% of the stores, and then the balance break even in the 6 months' time. So that's on track. We expect their EBITDA to get to roughly around 10% within the 24 to 30 month time period. So that's all good. The old stores, though, which are actually now growing at inflation plus, I think will probably continue to do that. They probably will end up, of course, it depends on the vintage of the store and all, but typically they will grow inflation plus. And that's what we're guiding, going forward.
So inflation plus, when you say you're expecting same-store sales growth to be inflation plus, when inflation could be falling to as low as 2-3% in the coming quarters. So just some indication. I mean, are you talking about mid-single digits, high single digits?
I would say more like high single digits.
Okay.
But yeah.
Okay.
Got that. Mr. Reddy, good morning. Always great to speak with you, sir. So how many stores are you opening this year? 26?
This year, we'll probably do around 600 stores. I mean, we have been doing that for a while. Last year was a blip, because of various reasons and because we had to kind of consolidate our back end. And we had to actually increase the capacity of our warehouses and everything else. So that took us a little bit of time. But I think we'll be back on track this year. 600 is a guaranteed, store opening net.
Okay. 2 questions. Where are bulk of these openings going to happen? Let's just get that out of the way first.
Sure. It'll probably be a mix between tier 1 and tier 2. And they will be in the states in which we are, currently present. We are there in 10 states. The new states for us are Madhya Pradesh, Chhattisgarh, and Kerala. So I think a portion of the stores, I would say at least 150 odd stores would come from those places. But otherwise, the balance will go into the states in which we're already there. As I said, we're there in 10 states as of now.
Okay. What about your own, I think this is something we've discussed in detail in earlier conversations, your own generics, private label in that sense.
Yeah.
And you'd said that, it's going to be long-term, hugely margin accretive.
That's it.
What's the share of what you sell now and how is that doing?
Sure. So by volume, and I'm saying volume because, by sales, it doesn't really count. Our drugs sell for roughly half the cost of a branded drug. So if you look at it by volume, I would say even today, roughly 25% of all medicines which we sell come from the MedPlus brand. And this number will be growing, at roughly about 1% every quarter.
Mm.
So
and how is that?
It'll be 26, every year 100 basis point as a share of the total sales.
Yeah, that's right. Every quarter.
Every quarter. Wow. So that's a very rapid accretion in that sense.
See, we started in June 23 and we're already at around 25% of the overall medicines. So we have had some initial gains. Obviously, the early adopters have come in and now it's going to be slightly slower, but I think it will probably be a slow and steady 1% every quarter is what I'm thinking.
So it's 25%, as a percentage of the overall volume. Sir, as a percentage of the top line, if I talk about your revenue, then how much contribution is coming from private labels right now and how do you see it scaling up?
Sure. So when I said 25% of the overall medicines, I meant, medicines account for 80% of our overall sales and 25% of that would be 20. So if you look at net sales, they'll probably be around 14 or 15%.
14 or 15% of net sales, the top line. Got that. So now, as you grow this, what will be the impact on margins? Fourth quarter, your margins improved quite a bit, but if I see the year as a whole, from that level of about 6+%, you were down to 4.5%. So just walk us through what happened there and what's the outlook on margins this year.
No. Actually, the margins did improve over last year. Operating EBITDA margin actually went up year on year from 3.9% last year this time to 5.3%. So this is margin accretive for us. Every 1% increase in private label increases our overall, this is by volume, increases our overall margin by around 15 basis points. So if I say that we're going to basically increase our overall sales by 4%, that means anywhere from 0.6 to 0.75% would be our overall increase in gross margin for us. Hugely accretive.
So let's just look out. We're already to 26. By end of FY 27, if this accretion goes on, where will margins be?
It's a simple math. So it'll just add.
So 15 basis points every quarter. So 60 basis points a year. And then so that's it.
Yeah, that's it. But obviously what will temper it a little bit are the drag of the new stores. Last year we added only 300. This per year we'll probably add 600 at least. So new stores, since they don't add as much initially, you will see a small drag. But otherwise, the gross margin itself will increase.
Okay. All right. Gross margins will increase. Fair enough.
Since we're talking about a more aggressive store rollout plan, sir, if you could just update us on the balance sheet as well. Cash, if at all you'll need to borrow this year. And how is the store rollout being funded? Is it all through internal cash?
We have zero debt. We have more than 400 crores in the bank. Mm-hmm. And we are, accreting margin every year. We are actually adding, profits to this thing out there. So I see no reason for any kind of bank loan. Our 600 stores typically will cost us around 30 lakhs a store. That includes the working capital and everything else. And that's 180 crores. That's covered well within the cash reserves which we have. Not to count of what we are going to add as we go forward. I don't see any need for raising fresh capital or taking any loan.
So all things put together, since you're adding 600 new stores and the break-even timeline, I think you said is just about 3 months for a store.
6 months.
Which is really...
Yeah.
3 months, right?
50% of the stores break even in 3 and the balance in 6. Yeah.
The balance in 3 to 6 months a store breaks even, which sounds very, very good. So all things put together, plus higher share of private labels. This year, what should the top line growth expectation be for your stakeholders?
Okay, top line has nothing to do with the private label thing. So it'll actually depress it a little bit, I would say. I would just count on the EBITDA just going up. Given that we are at 6,000, adding 600 stores, which don't really add too much in the first year. So I would still say, probably in the 15-20% kind of growth is what we would expect. 15% is what I'm thinking.
At the EBITDA level?
No, at the top line level.
At the top line.
EBITDA, of course, will, grow for sure. Yeah.
All right, Mr. Reddy, we'll leave it there. Thank you very much for joining us. It's a pleasure having you here on the program. That's MedPlus. So interesting company, building out a large footprint of physical, stores, medical stores, and in some ways, kind of sort of trying to build out what we have, for example, in the US, etc. Large chains organized. In that sense, huge. But of course, here we are getting started. 950 on MedPlus.